Good evening, everyone, and welcome. We are here with Dr. Sormani. Good morning, Sormani. How are you?
Good morning. I'm fine. I'm good here in Fortaleza, and I hope everyone is it's well in their countries.
I'm Dr. Jonas Ferreira. We are organizing this webinar with Dr. Sormani. It's a series of webinar. It's a pleasure to have you all here with us today. We are starting a monthly clinical webinar series where we'll be sharing real cases, discussing surgical decision making, and exchanging experience in practical and honest way. This is meant to be an open and collaborative space. If any of you would like to present a clinical case in future sessions, please feel free to contact me privately. You are very welcome to contribute. I would also like to share you an important update. We will have Dr. Sormani in Brisbane in June 13, 14 for an intensive hands-on program. In addition, we are opening the possibility for private surgical mentorship for those who would like to take this future and operate real cases alongside Dr. Sormani. Thank you again for being here, and let's begin. Well, we are in. What do you expect in Brisbane, Sormani, in your course? What do you
Uh,
think to do in Brisbane in your course in June?
I I have the best expectations to this course. I hope I will find friends there that were here in Fortaleza with me before on our live patients course, and I think it will be really a blast, and we will be really a great pleasure to see everyone again, and to make new friends in Australia. I have really good expectations about this
It
course.
will be our first time. Me first time too.
Yeah, and that besides the scientific program, we have the opportunity to go to Australia for the first time, and it's a country that I always had the desire to visit. So to me, it would be very special also.
Okay. This webinar, well, let's begin, Sormani. Make your presentation, please. Begin your presentation.
Okay, so welcome everyone. I'm Dr. Sormani Queiroz. I'm here to this series of webinars that we are doing uh, with our group of dentists around the world. Uh, and to me, it's really a pleasure to share with you more of my experience with zygomatic implants. And and once more, I want to invite you all to contact me and present your own cases. So I would like to see how you guys are doing your job after the course here in Fortaleza. So I want to see how is your experience and how you are conducting your own cases here. So to me, it will be a pleasure to open this space to you present your own cases. Uh, by now, I will present you another case, and I always like to share some cases of complications. Uh, I think I always think that complications are more interesting to discuss than the, let's say, the plain cases in which everything goes well. Of course, we want that the cases always goes well, but sometimes we have some problems, and I think we learn a lot when we have these problems. And I want to share with you these cases and show you my approach to solve these problems. And I think that it's very, very learnful for everyone. So I will share my screen here. A moment. Okay.
Tô vendo já direitinho.
Okay, I will show this case from this patient. It was a female patient, 60 years. So she has rheumatoid arthritis, and she takes methotrexate and prednisone one time a day. So this is important because, as we know, this type of disease is a disease in which we have some immune problems. The patient has some immune problems. It's an autoimmune problem disease. So she has to take these medicines, and these medicines affect the healing process, both the soft tissues healing process and the bone healing process. So these patients are prone to have problems with osseointegration also. So this was discussed with this patient. She was totally aware of this situation, so she has more risk to lose the implants. But she signed the former consenting and the statement, and we moved forward for the treatment. And in his case, in her case, she has the very atrophic bones, and with some osteoporosis that are secondary to the use of these medications also. And because of that, we opted for treatment with the quad zygoma approach. She were everywhere here in Fortaleza with many different surgeons, and all of them contraindicated the treatment, or they just said that she has to make a major reconstructive surgery. So she didn't want it, and I proposed to place some, to place 4 zygomatic implants. This case was we operated this case in one of our courses with some of our European doctors that came here to make our course, and this is a immediate picture after the placement of the implants. This was the day when we made the placement of the prosthesis. and we see these abutments installed in the patient. So this is the panoramic X-ray, post-op panoramic X-ray. So we could see these 4 zygomatic implants placement. It's a quad zygote case, and then this is the prosthesis after we installed it in the patient. This was in 2020, so 6 years ago. And we can see that the patient has this kind of occlusion here. And of course, this is not a good situation. And you see later, this was one of the cases of the causes of the problems that we had with this case in the future. And we can see here on the left side, so this patient didn't have any teeth here on the left or on the right side, and on the left side the same situation here, only canine to canine, so she doesn't have any kind of tooth contact here. And this, from the biomechanical point of view, is very, very bad. So you see that this contributed to the loss of the implants that I'll show you later. But you can see here that we had a good spread of the implants. I think this is a good position. And from the point of view of the implants, I think everything went very well in the position of these implants. So we were, although she has all these systemic issues, we were very confident with the outcome of this case. So this is the patient 4 days after the surgery, and she was smiling, she was happy, because finally she has fixed teeth. It was a dream of her, and we were able to give this to this patient. So we were happy, and the patient were happy also. These are the provisionals, and the picture after the positions, the provisionals were placed in position. But 2 years, almost 2 years later, this was the situation. All the implants with mobility, the patient was complaining about pain and sometimes swelling and even pus drainage through the sulcus. So it was a very bad situation. So it was the first time that I had the loss of the all 4 zygomatic implants, and we can discuss the causes of this later, but we now have to solve this situation. So the first thing is to remove the implants. Of course, this is a total loss of the implants, and we removed the 4 implants with the abutment and etc. So we removed the 4 implants, and we left the patient with a provisional, and after that we wait for, I think, 6 months or a little bit more. And we did this because the images of healing of the zygomas were not good still, so we opted to put these implants, placing 2 pterygoid implants, 2 short implants, and 2 standard implants in the area of lateral nasal wall and in the trying to anchor it in the vomer. Of course, this is not an ideal situation because this patient already has a very, very atrophic bone, so we didn't have any good position really to place anterior implants. In the posterior, we had the pterygoid pillar and some height here, and we opted to place these two short implants. Of course, this is not a good solution, but it was with what we did at the time, and so we just hoped for the best in this situation. But of course, the patient lost that implants also, and we have to put again 4 years later. The zygomas were healed, and we were able to put 3 more zygomatic implants, and this is the final situation in the maxilla. This was an option of the restorative dentist that opted to use this small implant instead of this pterygoid implant. I would choose differently, but it was an option of her restorative dentist, and we finally removed the lower teeth and placed it 4 implants, and now this patient is fully restored, and now the case is really doing very well. So I think it's important to discuss what are the causes of this massive loss of the implants, of the zygomatic implants. So I can discuss with you some probably causes of loss of implants. I think the first factor is this kind of occlusion. When you have this kind of patients that has only anterior teeth, this type of contact is very dangerous to the implants here, because you have the momentum of force applied all in this anterior area, generating compression forces on these anterior implants and extraction forces on the posterior implants. So this is very, very bad, and this will lead to prosthetic problems with broken abutments and screws, and also eventually with the loss of the implants due to overload in these posterior implants mainly. And in this case, it started with the posterior implants, and then the overload, it was transferred to the anterior implants, and we have the loss of all the 4 implants here. So of course, this was a case that was selected for the course, and in these situations we had to start with the maxillary implants. But today I don't recommend in these cases to start with the upper implants without solving the lower arch. So I always start solving the lower problem first. If the patient, for financial reasons, can't make both arches, I will always opt for start with the lower arch, because if you don't solve the problem properly in the lower arch, we will have an overload in the upper implants, and the patient will end up losing the upper implants and complicating the case. So this is the first cause for this massive loss of the implants. The second cause, to me, it was the systemic problems of the patient. So you have a first complication risk factor, that is the occlusion of the patient, and a second complication risk factor, that is the systemic situation of the patient with the rheumatoid arthritis that the patient has, and the medications that she was taking. So this is another factor that could cause the loss of the implants itself, and together with the overload due to this kind of occlusion, this probably will lead to the loss of the case. And in third, I have that this patient was not a good patient in the matter of coming back to the office to take care, to follow up, and etc. So this was a third situation in this particular case. So when we gone forward with the treatment, we had to really talk to the patient about the importance of coming to the follow-up visits to a good control, and so to have a good outcome for this patient, for this case. So this after the second loss of the implants, the patient started really to collaborate with us in the follow-up visits. So I think this is one case in which we could learn a lot about these risk factors, and now we are much more, aware of these situations to control this kind of risk factors, and we no more had this kind of massive loss of zygomatic implants. This was the only case in which I had to remove all the implants at one time, and fortunately this never happened again in our patients. So I hope you all in your all cases in the future. Okay, so this was our presentation for today, and I'm open to all of your considerations.
We have a question with you,
Or doubts
Haggett.
here.
Hello, Haggett. How are you, my friend? Do you consider switching to overdenture prosthesis when you had less bone?
Uh, Hi, Haggett. It's a pleasure to talk to you again. Yes, this is one of the possibilities. If I couldn't be able to place the number of implants that we placed before, this could be or after the problem, this could be a possibility. I did this before, but to me, my first goal is to deliver a fixed prosthesis to the patient. I only will place a removable prosthesis like a overdenture if it's it's really the only way to treat the case. So my first choice will be deliver a fixed treatment. So I I always try to search for this direction when I try to solve this kind of complications. Uh, and it's important to say that it when I place these cases, these are one of my very few cases of complications with major complications with zygomatic implants. I think we have uh, uh, a number of cases with minor complications, which we can handle in the office only with small procedures sometime, or some uh, adaptations in the prosthesis and etc. And this kind of major complications in which we have to remove the implant, or even doing some bigger implants, bigger surgeries to solve, are very rare. So it's not common to have this kind of complications. So I like to say that because sometimes when I show these complications, sometimes the people become afraid of doing these zygomatic implants. But uh, fortunately, these are very very rare. So, but even these are concerning situations, and we have to to be prepared to solve these cases. That's why I like to talk about complications. Of course, it's good to show you the very beautiful cases that we have, and I will show you in other webinars. But it's it's important to discuss the complications, trying to search for the causes, and the most important thing is how to solve these situations. So I have this experience, and I have to show how I solve these major complications cases, because it's not common to the people to talk about complications. So we see a lot of doctors and professors and etc. talking about the very beautiful cases, the cases in which everything gone well, but they don't like to talk about the complications. And this is an issue that I really like to approach and show to you how I solve it. Okay?
Okay. Well, let's to present for everybody. Dr. Sormani will be in Brisbane this year in 13, 14 June with this course, Advanced Full Arch and Zygomatic Implant course. Dr. Sormani with us at this moment. And this is the program. 2 days with hands-on and a lot of work with to do and a lot of some things to learn in this presentation. I hope you can enjoy this course. We will send to everybody the program complete, and you can make your register to this course. Okay, my friends, I would like to say thank you to everybody for this presentation, and to Sormani, thank you so much. And next month, we will stay here again. And Dr. Luch will will do a presentation, maybe next week. I will send to everybody the information, and you can see a student from Dr. Sormani presenting his case in this presentation too. It will be a pleasure. Thank you so much. If no have question at this moment, we will finish the presentation, and see you next month. Thank you, Sormani.
Thank you, Ragged. Thank you, everyone that was attending this webinar, and see you on the next opportunity.